Discussion on ECG showing atrial pacing artifact before each P wave. P waves have an abnormal shape and appear biphasic in most leads. PR interval is mildly prolonged. Paced P waves have a morphology different from the normal P waves because of a different conduction sequence. Please subscribe to this channel for future updates. Click on the subscribe button. Press the bell icon after that for all updates. Paced P waves can be wider than normal P waves for the same reason. Atria alone can be paced in 6 sinus syndrome where the AV conduction is intact. This will prevent potential future left ventricular dysfunction due to dyssynchrony, which can occur with long-term right ventricular pacing. Usual mode of pacing is AAI. That means pacing and sensing the atrium in inhibited mode. The same ECG pattern can be obtained even if there is a DDD, dual chamber pacing, dual chamber sensing, dual response, but only the atrial part is functioning. This can occur if the AV conduction is intact at the time of ECG recording. The DDD mode covers for potential deterioration of AV conduction later, producing ventricular systole. It is mandatory to establish the presence of a good conduction into the ventricles before considering single chamber atrial pacing. Electrophysiology study to check the HV interval will document whether the infrahisian conduction system is good. It can be rechecked after atrial pacing at a higher rate to see if it deteriorates at higher rates. People used to stress the AV conduction system with Ajmelin before deciding on single chamber atrial pacing in 6 sinus syndrome to make sure that AV conduction is intact and likely to remain so in the near future. Ajmelin has been shown to be useful in unmasking infrahisian disease. Journal reference on Ajmelin challenge to unmask infrahisian disease. Please don't forget to subscribe to this channel for future updates and click on the bell icon for all updates. Thank you.